hospitals after large numbers of healthcare workers succumbed to the virus. To talk to us more about this, I'm joined by Emeritus Professor of Critical Care at Wits, Guy Richards. Professor Richards, good evening, and thank you so much for your time. Firstly, perhaps just your own reflections on where government could have gotten it better, especially the second time around.
Yeah, well, I think that's a very critical issue. The primary issue being staff numbers. I think that nobody realized the extent to which staff would be depleted in terms of the numbers who have been ill, or not even necessarily ill, but who have had to be quarantined because they actually have had asymptomatic disease. In addition to that, it's occurred over the New Year period, New Year Christmas period, where people have taken leave. And so therefore we have had major staff shortages where in the intensive care unit, one ICU sister would be looking after 4 or 5 patients at any one time. Now that's really not an optimal situation in any circumstance. And really it's led to the fact that many patients are now being so-called triaged, in that they're not able to get into an ICU and are therefore being managed in makeshift shelters, often in parking lots in hospitals or in field hospitals, which often don't have sufficient oxygen. As I've mentioned on previous interviews, the actual preparation is far more than just creating a number of beds. It actually means making sure that there's enough oxygen, that there's enough staff, that there are food facilities, that there are cleaning staff, that all of those things actually have to be taken into account. And that requires enormous logistical support and enormous skill in terms of arranging and managing all of these types of situations. And we really have fallen short to the extent that our hospitals currently, certainly in Gauteng, are overrun. And every day I am seeing appeals from various hospitals for, does anybody have a bed? And will there be space for my patients specifically? And we just are not adequately prepared.
You raise a good example of the situation in Gauteng, and over the weekend we've just seen videos also emerging out of the Steve Biko Academic Hospital where it's just completely overcrowded and it's a desperate situation for those who are seeking treatment there. Do you think that this time around government was a lot more perhaps relaxed might not be the word for it, but they didn't put as much effort into making sure the country was ready as they did the first time round, because we know that they'd even shut down a number of the hospitals the field hospitals that had been prepared should we face an overwhelming number of COVID-19 cases?
Well, I think that's probably correct. And one of the big factors being that we managed the first surge relatively well in terms of the numbers of beds that we actually had. This second surge that we're having now is far greater in terms of admissions than the first one was. And we are seeing very ill patients who are requiring oxygen and various forms of ventilation that are requiring beds to be available. And yes, I agree that because we managed so well on the first episode, it was not recognized that this one would be as bad as it actually has been. And we are now sitting in a situation of absolute crisis and desperately hoping for the surge to start a downward trend.
What is the effect of this on health workers? And Professor Richards, if you can, give us a sense of what many of yourselves and your colleagues have had to endure, because while we may be speaking about a second wave, the reality is that health workers have been at it since last year, round about April, when we had the first lockdown. Many have been working overtime since then, and those who haven't lost their lives have recovered at home, gone back to work under even more strenuous circumstances.
No, you're absolutely right. And in fact, this applies to all categories of health workers. Overall, the feeling that you get on our Twitter feeds where we communicate with each other is overwhelming exhaustion. a despair and desperation in terms of what to do with our patients when they actually arrive. You must realize that we are in a profession that is involved with caring for and treating ill patients. And you get to a point where there just are no facilities available and patients are dying around one. That despair is difficult to describe. And in fact, the amount of stress that the healthcare workers are experiencing is enormous and difficult to actually grasp.
Of course, it doesn't also help that in the midst of all of this, we have research that comes out that raises big questions around the quality of PPE that has been distributed to some workers and whether or not it is actually efficient in protecting them against the virus.
Well, I think that that is something that certainly up until very recently, the healthcare workers have felt that they have had inadequate support. And that inadequate support includes availability overall of PPE and then availability of quality PPE. And of course, that's absolutely mandatory for one to feel secure. The, uh, the problem also is that there was a feeling that it was a casual attitude towards access of vaccines for healthcare workers, because that's an additional stress that they are living under. There is this misconception that the only people who die are the elderly or the infirm, and that just isn't the case. We are seeing patients, I say young patients relative to me certainly, but young patients from 35 years up and even younger who are in critical condition and are dying. Yes, the percentages are less in that age group, but they in fact are certainly significant in terms of their numbers. And this applies to the age group of most of the healthcare workers that are currently putting their backs to the wall and being the heroes in terms of the management of this whole crisis.
Is a vaccine the only way out of the situation right now?
Well, we do know, and I still firmly believe that the actual social distancing and mask wearing and limiting public gatherings of any type, religious gatherings, weddings, funerals, I know that's harsh and it's something that people don't accept, that they would want to have a big funeral and send off for relatives and loved ones. But in fact, these all are super spreading events. So one needs to stop those. Social distancing, mask wearing, avoid congregating in areas where other people are as far as you possibly can. And then, yes, vaccine is the absolute critical component of the actual response that we actually need to have. So certainly we know we are accessing some vaccine, which will be allocated to the healthcare workers, but we need ultimately to have enough vaccine to get out there in the community, to have enough people that have some immunity, that we then get the so-called herd immunity, whereby if you are infected, those people around you may well be protected by having antibodies and therefore would not be able to spread it on to the extent that it currently is spreading.
Professor Richards, when you look at the issue of capacity, because it's a big issue right now, the numbers don't look like they're on the downward trajectory just yet. So we're still going to be in this place for at least the next couple of weeks. What is it that the state can do immediately to alleviate the pressure that's on healthcare workers?
Well, I think to try and increase the numbers is absolutely critical. There are a number of young doctors out there, community service doctors, for example, who haven't been offered jobs from this year. Now, that's critical. One needs to access as many people as you possibly can to actually assist in managing the patients out there. Provide appropriate PPE to all the doctors, and provide adequate psychological support. Now, most doctors and nurses and cleaning staff and all the other healthcare workers are often reluctant to go and get counseling and assistance through this a very trying period. But I would recommend that, as far as possible, that people do go for counseling and to discuss as much as you can with people that you trust in terms of the feelings that they're actually going through at the moment.
All right. Thank you so much for your time. Emeritus Professor of Critical Care at Wits University, Professor Guy Richards.